And good morning, good afternoon, good evening. Welcome everybody to today's Maternity Natural Health webinar. And hi, I'm Kathy Frey. I'm from IMCO, the International Integrative Maternity Healthcare Organisation, and I can see numbers starting to click on in for this webinar. And I'm so thrilled today to have Jocelyn Wood here. Jocelyn, say hello.
Hi, everybody.
And Jocelyn is coming live to us from New York. We've got a fascinating topic today, which is all about tongue ties. And we were just discussing in the green room before coming in here live, and how this has really come back, that this information is coming back. It was almost 20 years ago when I started writing my own baby book, when I was researching for it, and sat down with New Zealand's leading lactation expert, Dr. Yvonne Lafort, and she taught me all about this. And at that stage, it really wasn't common knowledge. It was lost knowledge. This isn't new knowledge. This is old knowledge, which Jocelyn's going to talk about today. So it's just fantastic to have her today talking about this, because you know, as we discussed a little bit earlier, if you're bottle feeding, you can do it with the tongue tie, but if you're breastfeeding, no. And so it's really important that we know about this. And yeah, so those of you that are signing in, look, do go into the chat area and let us know whereabouts you are in the world and what your role is. Are you a health practitioner or a birth practitioner, a mum with an expectant belly full of baby? So let us know who you are and where you are. That'd be wonderful. Also, just a reminder that down the bottom is the little Q&A bottom. Down the bottom of your screen is the little Q&A button. So if you've got any questions for Jocelyn today, please do type them in there, and we'll absolutely make sure we get through the questions before we finish today. And I can see a little bit of chat coming in there. Hello from Australia, and oh, it's early in the morning there for you guys. You're probably eating your breakfast cereal with us, and so that's just wonderful. So look, I'm going to introduce Jocelyn now, and so welcome everybody. Thank you for coming along to today's webinar, because of course if you weren't watching, there's not a lot of point in going live. So we appreciate the audience, that's for sure. So Jocelyn is a bilingual speech language pathologist with over a decade of experience, and she is specialized training in orofacial or myofunctional therapy, and the treatment of the tongue and lip ties across the lifespan. So that's so very important. She works with families to make a plan to optimize function using exercises and activities tailored to the individual. And she's been featured in a few magazines, including the Bump and First Time Parents. So today she's going to go over the history of tongue ties, diagnosis, treatment, signs and symptoms, the red flags that we should look out for, exercises after the tongue tie release, etc. So this is there's going to be a PowerPoint that Jocelyn's going to be putting up live soon, and so this is I'm very excited to hear this wonderfully important information, because boy, if you're trying to breastfeed, especially if you're a first-time mum and you've got a baby with a lip tie, a tongue tie, it is, or a lip tie, it is very, very challenging. So welcome Jocelyn.
All right, so let me just pull up my presentation. I am so excited to be here today presenting to all of you. I know that this is such an important topic, and it's pretty amazing with the technology that we have these days, that I can be here in New York presenting to New Zealand and Australia and providing this information. And tongue and lip ties are something that I am truly passionate about. I see so many parents and young children who have tongue and lip ties, and I love to be able to be there with parents to help to support them and guide them and breastfeed and feel successful as a breastfeeding mother. And these tongue and lip ties, these restrictions are going to carry with you throughout. So I'm going to touch on all of that today and some exercises to empower you to be able to guide your child's care, whether it be prior to treatment of a tongue and lip tie, during the treatment of it, or afterwards. So today we're going to be going over the history of treatment methods and tongue and lip ties, which I think will surprise many of you. We are going to talk about what are tethered oral tissues or TOTs, what you're going to look for as a parent or a provider, how to safely transition children with tongue and lip ties to solids, some exercises for home, and then some guidance on when to seek help, and most importantly, who it is that you should be looking for when looking for a professional. So let's get into the history of tongue and lip ties together. I think the most surprising thing for everybody to know is that tongue and lip ties, contrary to popular belief, are not a fad. They're not something that is new, that has just recently been discovered. They are something that have affected children and infants from the medieval times. And I think one of the coolest pieces of information that I learned about tongue and lip ties is that they used to be treated by midwives. And for the purpose of treating a tongue tie, the midwives would have an exceptionally long pinky nail. And what they would do is take the pinky nail and swipe underneath the tongue to eliminate the excess tissue that was causing the restriction. And then this would allow parents to be able to successfully breastfeed. So without even leaving the examination room, the midwife would examine the newborn child, swipe the finger underneath the tongue, check to see whether there was a tongue tie evident. If there was, that long fingernail would just get rid of it. And this is a practice that continued up until the early 1900s. And what then began to happen was the introduction of bottle feeding. And what happens because of the structure of the mouth, when we are bottle feeding, we don't need to use our tongue in the same way that we would need to for breastfeeding. And so what happened is, as bottle feeding and the use of formula became more of the norm towards the 1940s, 1950s, and there wasn't so much breastfeeding happening, the use of that long fingernail kind of fell out of style. And it was no longer something that was checked for in the hospital because many parents had decided to bottle feed rather than breastfeed at that time. Now, fast forward until more recent times in the late 80s, early 90s, breastfeeding is once again in fashion. And lots of parents are deciding to breastfeed their children. And what we're seeing is not necessarily a greater occurrence of tongue and lip tie, but what's happening is we're noticing that these tethered oral tissues are happening more because we have more children who are breastfeeding and who need that function of their tongue. They need that mobility of the upper lip to be able to pull down over the nipple. They need that tongue movement to be able to curl around the nipple and extract liquid. So I've been using the word TOTS. What is a TOT? What is tethered oral tissue? So tethered oral tissue can occur in several different places. It can occur underneath the lips. So you'll see in this top picture, there is a piece of skin that goes in between a child's front teeth. If there are no teeth, it would be in the spot where the child's front two teeth would emerge. And what that is going to do is cause some difficulty with mobility of the upper lip. On the bottom, I have a picture of an anterior tongue tie. And what that means is that the front of the tongue is tethered to the bottom of the mouth. And that is obviously going to make it very difficult for a child to stick their tongue out of their mouth. It's going to make it difficult to fold the tongue to get around the nipple. It's also going to make it very difficult for the child to have that forward and backwards movement that is needed for breastfeeding. There is another type of tethered oral tissue that happens towards the back of the tongue, and that would be a posterior tongue tie. It's difficult to find pictures of this, but some things that you might see are also limited mobility, an open mouth posture, or a child that has difficulty bringing their tongue up to reach the top of the mouth. It might also cause some difficulty with folding the tongue and getting that movement of the side of the tongue. There's another type of tethered oral tissue called a buccal tie, which would be a tie that's in the cheeks. That would make it very difficult for a child to get that round movement that they need to suck from the breast. It would also make it very difficult for a child to retract their lips. And so let's go into what you can look for. There are different signs and symptoms that parents might indicate that would be a cause for concern or a reason for you to look into the presence of a tongue tie a little bit more. So if we go back to this first picture of the anterior tongue tie, what you're noticing is that the front of the tongue is going a little bit. So that's going to be your first sign that there may be some tethered oil. There might be something that is not so visually evident. And so you are going to have to use your detective skills a little bit to put the pieces together and see whether or not there may be a tongue tie or a lip tie. Interestingly, if a child has a lip tie, more often than not, they are also going to have a tongue tie. So if you see that lip tie, it's also going to be a reason for you to be checking the back of the tongue to see if there is another restriction. You may have had parents come to you and say that their child is fussy or cranky, very gassy. That would be another reason to be checking for these tissues. When you are breastfeeding, some evidence of a tongue or a lip tie may be that there's a loss of a liquid from the sides of the mouth while breastfeeding. That would tell me that there's not so much lip closure. So there may be a buccal restriction. There may be a tongue restriction that's preventing the child from fully cupping around the nipple. Or there may also be a lip tie, which is not allowing that top lip to come around the nipple. Parents also may complain of some nipple pain or soreness. Some parents, in even more severe cases, may even have mastitis. After feeding, parents may recognize some reflux symptoms, or a child is vomiting a lot after the meal, and not just a little spit up that may be common with infants and newborns, but it may be a lot more reflux, and it may be a darker color. Other things to look for would be some difficulty with sleeping or staying asleep. The reason why this happens is because it's very difficult for the tongue to reach up to the top of the mouth and make that connection, which is going to make sleep come easier and more natural. You may also hear a clicking sound, like while the child is feeding. That's letting me know that a lot of air is entering into the child's mouth. That could be another reason for that gassiness or colic, and also for the reflexes, that a lot of air is getting into the child's system. There may be a little bit of a weak suck, which is going to make the child either a slower feeder, or also could be a cause that the child keeps falling off of the breast rather than staying connected, attached, and latched during the feeding to get the most milk in the most efficient use of time. And another big one for infants who are breastfeeding who do have some tethered oral tissue is little to no weight gain. You might even see that your child is losing weight following the time that they are leaving the hospital. So these are just some of the signs and symptoms that you would see in newborns and infants. I did not go into any of the signs that you might see in an older child, a toddler, or a preschool age child, but there are other things that show up across the lifespan that would warrant somebody, an ENT or a dentist, to look to see if there is some tethered oral tissue. Now, you might be wondering what you can do on your own before being able to meet with somebody to help you to address these issues. So the first thing that I am always suggesting to parents who notice that there might be a restriction is to get your positioning down. And there are definitely some breastfeeding will be a little bit more comfortable for a child who has a restriction, because we do know that when children have restrictions, there is going to be less jaw mobility, which is going to make it much more difficult to latch. So a lot of parents that I work with have a lot of success either pancaking their breast to make a little sandwich so that the child can more easily latch onto the nipple, even though their jaw is opening a little bit less. Whenever you're doing any positioning, I think the most important thing to keep in mind is that your baby's nose is in line with the nipple. Another really great position for children who have this restriction is either to have your child in a koala hold laying on top of you, or to be in a side lying position so that your child is more readily able to latch onto the breast without needing to rely so much on their own positioning of their jaw, their tongue, and their lips. You're doing the work for them so that they can more easily latch on. So after we get through the initial latches and breastfeeding stages, you're going to be ready to start transitioning your child to solids. And if there is still a tongue or a lip tie, or if breastfeeding happened to go well, and there might still actually be a posterior tongue tie, you may also see some signs and symptoms of that tie when introducing solid foods. So if you did notice the tongue tie early on and decided to treat it, it may be necessary when introducing solid food to continue to do some work on tongue mobility or lip usage to help your child to be able to safely move food from side to side to help get that mastication. And if you had a restriction, your tongue might not be able to do that side to side movement that is going to be necessary. The other concern would be that a child who had a lip tie does not have the same amount of mobility to get their lips around the spoon to pull food off of the spoon. So that may be a point that you would want to work with an interventionist or a specialist in tongue and lip ties to learn some of those exercises to help support the transition to solid foods. Babies who have had a history of a tongue and lip tie do very well with a baby-led weaning approach, where they're able to guide the food towards their mouth, discover where to put the foods, and then they're better able to discover how their tongue can move around to get the food around the mouth and to learn that appropriate chew and swallow. Now, if you have a child without a treatment for a tie, and I don't know why my picture is not showing up here, you may notice some more difficulty with that tongue mobility. What you might see is a child who is losing some food out of the front of their mouth. They might get the food into their mouth and have the tongue push the food back forward. And you might even notice that your child is gagging, not because they're choking on food, but because the restriction on the back of the tongue is making it more difficult for them to have an appropriate swallow, and that feeling is uncomfortable for the child. So the goal here is to decrease any of these symptoms so that you can avoid having a picky eater. Lots of times when there is a child with an undiagnosed tongue and lip tie, that's going to show up around their second birthday as a child who is a little bit more of a picky eater. They might be limited in what they're eating because they're avoiding more complex textures such as meats or vegetables that are a little more difficult for them to chew. So what can we do about it? I've been talking a lot about ties in the lip and ties from the tongue, and each of those have their own set of exercises that can be done either prior to a release, right after the release is done, or when you're introducing that next stage of feeding, as we've been talking about. So for the lips, the first exercise that I like to introduce to my families is a little bit of a facial massage. And what I do is I take my pointer and middle finger and I'll start to tap around the top of my lip and around the bottom of my lip. And that's going to help the child to orientate to their lips, to get those lips moving and woken up to be ready for the breastfeeding experience, the bottle feeding experience, or for the solid food experience. So we want to bring attention to the muscles that are going to work by putting our fingers around and really waking up those muscles. Another really great way to do this exercise would to be to use a warm washcloth that you can also tap around the lips. And the next exercise is going to be to wake up the sides of the lips. What you're going to do is take a clean finger, go underneath the top lip, and make the shape of a C that goes around. You're going to go a C on one side, a C on the other side. You can do it as the baby tolerates it. Some babies really do like this motion. They'll start smiling and giggling. There are other babies that are quite fussy about it. So you are going to judge how your baby responds to the exercise to determine how long to attempt it. And the last exercise that I like to do, especially if there was a lip tie, is to help to stretch out that upper lip. I take my thumb and my pointer finger and I'll pull my lip up towards my nose and I'll hold it. I may hold it for 5 seconds, 10 seconds, again, judging by the age of your child, also by how fussy they are when presented with these exercises. There are also some exercises to do to encourage the mobility of the tongue. So the tongue is going to naturally want to go from side to side. It's a reflex that babies have, and we can encourage that by using our finger to tap on the side, or by using an infant toothbrush on our finger to gently swipe at the sides of the mouth and get the tongue to stick out and to the side, stick out and to the side. We can also use that same toothbrush to go from the back of the tongue up to the front of the tongue, which is going to be really helpful in reducing that gagging reflex that we were talking about earlier. We want to be able to desensitize that gag reflex before the child gets any of those symptoms of picky eating. Another exercise that you can do with a baby to increase mobility of the tongue is to help to lift that tongue up towards the palate. So you're going to use your thumbs to go underneath the tongue and lift your tongue up to the top like this. If you have a really young child, you can facilitate this movement by holding underneath the child's head and gently positioning them at a downward angle so that your thumb will slip right underneath the tongue and be able to push it up towards the palate. The third exercise, the most advanced exercise, is to do tongue curls, trying to get that tongue to lift and going to get around the nipple to facilitate feeding. And the best way to do this is to use the same infant toothbrush and gently push down on the center of the tongue, which is going to get the sides of the tongue facilitate that movement to get and a little bit of touch. There are so many benefits to performing these, whether your child has already had a release performed or if you are expecting a. And the reason why I say to do or having a release, want to have some of that mobility before the release is done, so that after the release is done, you can
Hi, everybody. We seem to have lost Jocelyn there for a little bit. Um, okay, hopefully we'll get it. She will dial back in and we'll be all good. I'll just going to pause the recording.
Hi, sorry, I lost the connection there.
It's
I am just
all good. All
hop
good.
right
We were
back
hoping you'd dial back in
in.
and you have. So all great.
So let me just get back into my presentation here. So as I was saying, there are so many benefits to performing the exercises, whether you are doing it prior to doing the release or after you have had a release. And the reason why is because it can really help to improve the mobility. It can also really help to improve in half. It can also really help to reduce the pain that the mother is feeling during breastfeeding. So, when should you be seeking help? If you're consistently performing these exercises for 2 weeks and you're continuing to feel pain, it's definitely time to seek help. You do not want to go for a long period of time with pain during breastfeeding, because that's really going to impact the relationship that you're building with your newborn and infant. Another big reason is poor weight gain. If you go to your child's second pediatric visit and they're still not gaining any weight from breastfeeding, that's going to be time to contact either a lactation consultant or a speech therapist. I'll get into a little bit more about how to know who to contact and when. If your child is having a lot of reflux, that's going to be another cause of concern. Any loss of liquid after the first 2 weeks, and also any clicking that you're hearing during feeding, is going to be a time to contact a specialist. So, how do you know who is a specialist and who to contact? You're going to always try to make sure that you're contacting a preferred provider for TOTS. This differs for different countries, and I know that there are providers from many different countries and parents from many different countries on here, but you always want to make sure that you're finding somebody who specializes in the treatment of tethered oral tissue, because it's not something that anybody is taught in any particular school. It's not something that we were taught in speech pathology school. It's not something that all dentists have training in or all ENTs have training in. It's something that you really have to seek out individualized training in to know what to look for. So in general, the person responsible for treating tethered oral tissue would be a pediatric dentist or a pediatric ENT. But if you wanted to perform some exercises prior to doing a release, you may meet with a lactation consultant who has specialized training in this to give you some positioning ideas, a speech therapist or an occupational therapist who has specialized training in orofacial myology, how the mouth moves, how the muscles move, and how that relates to breastfeeding through the life and other feeding issues through the lifespan. Or you may decide to do some body work to help to get some release of that fascia and that tissue from somebody like a craniosacral therapist or a chiropractor who has specialization in working with newborns and infants. So I have given you a ton of information in a very short piece of time. I would love to know if you have any questions. I am out there on the World Wide Web and happy to answer any questions for you as well. But right now, I want to open it up to anything that's come up for you during this chat.
Oh, that's been so fantastic. Thank you so much, Jocelyn. We don't have any unanswered questions at the moment, so we'll let those come on in. But I do, I noticed that you were talking about the who can you go and see? I'm not, I know that in New Zealand, I'm not sure about Australia. In New Zealand, it's very common that it would be a midwife that you would see for a tongue tie release who's been trained to do that. Or also we have quite a number of local GPs, so local community MDs that do that as well. So if the woman has absolutely sort of no idea where to start to potentially have somebody do a release of that tissue, where would you say is the best place to start? I imagine it would be a lactation consultant, and then they could on refer if they're not trained.
Yeah, and I love that information that the midwives and GPs in New Zealand have training in this. It's not the case here in the United States. So I would say, as a general rule of thumb, to contact the lactation consultant, somebody who has real training in lactation, in breastfeeding, who is then able to refer to somebody within his or her network for the best type of care.
And potentially even, you know, La Laish League would be a good place to start as far as getting that assistance with the lactation and getting a hold of a lactation consultant. Of course, from there, you know, they can do that referral to that specialist who's been trained. Certainly, I've known a lot of situations where those anterior ties have been they're so simple and instant to release and make such a dramatic difference, you know, immediately to the baby being less fussy and able to feed better, and the mother's nipples being just so much less traumatized. But certainly with the the posterior tongue ties, those are ones that seem to be medically more complicated and needing to see a level of oral dental surgeon there. What's the, maybe you could just go over what the commonest treatments are that occur for those different tissue ties.
Sure. So as you mentioned, anterior ties are much easier to find and much easier to treat. So when you have a child who has an anterior tie, you're really, as I showed in that picture, you're going to see that tongue really stuck to the bottom.
Oh, we seem to have lost Jocelyn there a little bit. She's just a bit frozen. Hopefully that'll fix itself soon. So, oh, sorry, I've got a message there from Petra. It is not common for midwives to perform tongue tie releases. Oh, yes, I absolutely agree. This is not a common. Yeah. Oh, we just lost you there for a little bit, Jocelyn.
I'm back.
Yeah. So just talking about a question here. No, it's not common for midwives to do the release, but it is common for midwives to be the people who are trained to be able to do those. So certainly on birthing suites, it's quite often the lactation consultant or the midwife that has had training in that area to be able to do that. Yeah. Referrals go through lactation consultants and most referred to a GP specialist. Yeah. Oh, okay. So it probably just depends on the hospitals that people are at, obviously, because there are certainly some hospitals around that have a number of midwives trained in that. Oh, yes. And we've got a question here. Do you have more information on the posterior ties? Latest information out is that they do not exist, question mark. Hazel Baker's latest talks dispute the existence of posterior tongue tie. That's an interesting comment coming through, Jocelyn, from a midwife and lactation consultant. What's your comment there?
So yeah, posterior tongue ties, in my clinical opinion and what I've seen clinically, posterior tongue ties present much differently than anterior tongue ties. And as I was saying before we got cut off, a lot of times posterior tongue ties, because they are so sneaky, might not present themselves until a little bit later when a child is being introduced to solids. That child might be able to breastfeed successfully, but then have some difficulty later down the line with eating solid foods, or potentially with creating some speech sounds because of the way that the tongue needs to move to create those speech sounds. So those are two different for clinically for posterior tongue ties, and they are just a little bit different than anterior tongue ties. Not to say that they don't exist, but they really are two completely different entities.
Now, we got cut off, Jocelyn, just when you were talking about the commonest treatments that are done to release these tongue ties, the different ones. Do you want to just go over that?
Sure. So the two main types of treatment would be either a scalpel treatment, which is most similar to what the midwives would do in the medieval times, to use the fingernails to go under the tongue. But more common these days, and I think a little bit more successful, is use of a laser procedure to release the tissue. And the reason why I think that this is a little bit more successful is because it is able to get a little bit deeper than the scalpel, and it's able to really get those fascia ties that are in there. Though some children who do have a posterior tie may need two of those laser procedures to fully release the tie. So it might be release, exercises, release.
Right. Laura from Australia makes a comment. There's a lot of discussion around overdiagnosis of these tethered oral ties or tissue. And we sort of kind of covered that a little bit at the beginning. You know, are you hearing this elsewhere? I certainly know that here in New Zealand there has been such a rise in awareness of it that I don't think it's being overly diagnosed. Is more to the point, we're just more aware, and that's what you were saying too. Are you hearing this from other countries apart from? Yeah.
Yeah, I agree with that. The official number is that it's 5% of live births have a tethered oral tissue. But as you said, we are much more aware of it. And because of the increase in mothers who are choosing to breastfeed, I think we're identifying them a little bit more. Not that we're overdiagnosing them, just that we're more aware and seeing more of it.
Yeah. Do you think that there is a level of almost overdiagnosis where are you seeing cases sometimes where somebody's referred and you're looking at going, yeah, that's not a tongue tie? I mean, are you seeing that as well?
Yeah, that definitely happens. I think, you know, when parents are looking for treatment, when they're having difficulty with breastfeeding, tongue or a lip tie is like an easy fix, right? You just see it and you fix it and then it's gone. And so that might be the first thing to look for, the first differential diagnosis. But I do sometimes get calls where I'm like, no, that's not it. More often than not, it is a tie, but sometimes there's something else happening.
So that's when you've got parents coming to you, which makes sense that they're coming to check if there is a tie. but do you have situations where health professionals are misdiagnosing? Do you see that very much?
Sometimes I do. Sometimes, usually when I am meeting with children, it's either their first step, they're contacting me to do exercises prior to doing treatment and looking for an opinion, or I'll see children after they've already been treated for a tie.
Okay. Let me see what else we've got going on here. Done. Oh, that's wonderful. All right. I'm looking at my you made a comment sort of back at the beginning that I just picked up on. I thought, oh, what's that? And you were talking about one of the symptoms of having a tongue tie and the baby having reflux, and when they would vomit up a little bit. And although reflux tends to be sort of projectile vomits, but and you said that the color could be a little bit darker of the vomit. Can you just explain why that would be?
Sure. Sometimes what's happening when a child is refluxing is that it is mixing with bile in the stomach. So you might see a yellowish tint to the reflux, and that's going to be a definite sign to contact your GP or a specialist in gastroenterology to look a little bit deeper at what's happening.
Right. Okay. I That's what I was suspecting, but I was like, oh, is there something else? I was wondering, oh, I wonder if she's thinking that they're swallowing a little bit of blood or what that was
I
about.
hope not.
Yeah, I was like, okay. So that's really great. Sometimes I've had situations myself with clients where I'm pretty sure this baby's got a tongue tie. You know, I'm not formally trained to diagnose it, but as a midwife, you see it and you think, yeah, I'm pretty sure it's pretty obvious to me. And, you know, parents would be a little concerned about the idea of having it released, and is that going to hurt their baby? And I get that. And they'd often also sort of say, well, what's the situation if I don't fix it? You know, if we leave it? Um, and one of the things that would be my sort of go-to explanation is that I talk about Jamie Oliver, who's the chef, and you know, people would say, well, how's it going to affect them? I said, well, right now it's hurting your nipples, but once your baby is older, if their tongue is tethered to the bottom of their mouth, then they're going to talk like Jamie Oliver because they can't lift the tongue. And people would go, oh, you know, as soon as mum or dads would go, oh no, we don't want our child talking like that later on. So sometimes that would be kind of all that would tip them over the edge to go, okay, we understand that this is not going to be just about feeding and just about sore nipples. This is going to be an impact along the way. And I also have always been of the belief, but maybe you can agree or disagree, that I think that it is a lot easier to do it on the younger the baby, the easier it is to do it, because that physically is a smaller piece of tissue. Whereas if you're going to do, say, a tongue tie release on a 5-year-old or something, I'm imagining that would be a lot more trauma to the child because there's more tether. What's your thoughts there?
Right. So my favorite story to tell about this is I worked with a 16-year-old client that I took to have his tongue tie release performed. And he wouldn't speak to me for a week afterwards because of the pain that he was in. Afterwards, he was very thankful that we went to have the procedure done. And he was having a lot of those Jamie Oliver speech problems that you were speaking about. But after the release, he was able to get his mobility back. And when you are a baby, that tissue is so thin and you don't have all of those fascial ties in there, it's going to be much easier for you to do a procedure. That's why midwives were able to use their fingernail, because that tissue is so thin.
Yeah.
And I would say up until like the first 2 weeks of life, doing that release is going to be pretty much pain free for the baby. Afterwards, I would say that the pain is pretty light because of the quickness of the laser procedure. It usually happens in under 30 seconds. So
Yeah. I
it's
would
pretty quick and
completely
pretty
agree.
painless. And for
Mm.
babies, the recovery is quick. Yeah.
It certainly does. Observing the babies, it does look like a very, in general, a really quick recovery. And as soon as it's done, you know, get that baby straight away latched, and you can almost see on the baby that they're like, oh, I'm getting all this food, yay! And it's like they
Yeah.
completely forget that you've just, you know, sliced a little bit of their skin just then. And yeah, no, they're more interested in the fact that they're making more. They're able to suckle in more milk straight away. There certainly doesn't seem to be, even, you know, an hour later, or it's certainly a day later, there's just doesn't seem to be any repercussions of the baby still being miserable. Yeah, so if anything, they just seem a whole lot happier.
Yeah.
Yeah, this is wonderful. So oh, okay, we've got another question here. I have heard that children can grow out of tongue ties. Is this true?
I think that it's fairly difficult for a child to grow out of a tie. Sometimes what might happen is if your child has a lip tie and has some type of traumatic event, such as like falling off of a bicycle, what might happen is that that skin would split open and release it. Also, doing some of these lateralization exercises might help to release the tongue slightly, but it's not so much something that a child would grow out of.
Right. Okay. Well, we're almost out of time there. So if anybody's got any other last minute questions for Jocelyn, do send them through on the Q&A. That would just be wonderful. And I'm just looking at my other notes here. I think that's all. Is there anything else, Jocelyn, that you'd like to add into the end that you feel like we need to just cover off on?
Yeah, I just think one important thing to note is that each country is really dealing with this in a different way. I think one of the ways that we can use this platform is to work together to come up with some type of international screening guidelines, because as we discussed here, once you notice that there is an issue, you're better able to look for that. The earlier that you do that, the easier it's going to be to treat that baby. So if we did have something universally that we're able to look for, it's going to be better for babies, it's going to be better for their parents, and it's going to be better overall for that maternal health.
That's right. Absolutely. And, you know, when you say that because there are more people breastfeeding, um, particularly in America now, it's becoming more popular, whereas in some other countries it has remained as popular for a long time. But um, uh, then, you know, this is being noticed more. But we're also, in reverse of that, we could say that part of the reason that was not so much successful breastfeeding before is the lack of knowledge. And, you know, so many women would be having these incredibly traumatized nipples with these, you know, babies that are fussing and not weight gaining, and they're going, well, clearly my breastfeeding, it isn't working, let's start on formula, without realizing, because there wasn't the knowledge. So it's kind of a bit of both worlds, I think.
Yeah,
All
absolutely.
right, I've just got another question here. My son has acid reflux and was diagnosed with a slight tongue tie in the hospital. Would you suggest going to an ENT to get the laser surgery done?
Yeah, so it really depends. As we said, it depends on the country where you're located, but I would look towards a list of preferred providers. If you just Google preferred providers for tongue tie, you would be able to find a list in your area and make sure that you go to somebody who is well trained in the diagnosis and treatment of tongue ties.
Yeah. Or as you say, talking to a lactation consultant who would definitely, they would always know somebody that they can refer to. So I guess the point is to have that child diagnosed by that professional so they can tell you, yes, this should be treated or shouldn't, and then you'll know whether it's the right thing
Right.
to do or not. Mm.
Yeah.
Okay. Yeah, so look, that is just wonderful. Thank you, we're going to wind it up there. And we always appreciate your lovely comments, everybody, as you do put them in there. And it's really appreciated. And of course, there've been little point doing these webinars if we didn't have an audience. So that's really great. And we're just wrapped to bring this information to everybody. So, and do always feel free to, spread the word and tell your other mothers that you know about who are expecting babies, and of course all the other health professionals in maternity health care that you know of, that we exist. So let them know about IMCO, and jump on board and get to know this, because we're actually fully booked with these webinar specialists coming through for around about the next 6 months, which is pretty phenomenal. And so it's a very exciting that we're able to bring this information to everybody. Okay, so look, everyone have a wonderful rest of your day, rest of your week, and we'll see you same time, same place, hopefully next week. Bye, everybody. Thank you,
Bye. Thank
Jocelyn.
you.
See you.